Hi everyone. I'm narrating most of my PowerPoint slides from this point forward. Wherever you see the sound recording button, click on it and listen to what I have to say about each slide. I've especially done this in any slide that shows images or charts primarily. I've also provided alt text for any standalone images or charts or graphics, but not for diagrams that I've created myself. If you have difficulty seeing or accessing any images in my slides, please let me know and I can help you understand. We can think of deviance as any behavior which violates social norms, and just like social norms, acts of deviance may be small or large. We don't often think of deviance as positive. We generally think deviance is synonymous with some negative behavior. But we can come up with examples of positive deviance, since deviance is just anything that violates social norms. For example, leaving an especially large tip at a restaurant, or going out of your way to help someone when it's not expected, are all examples of positive deviance. Deviance is highly dependent on culture. So, for example, some cultures consider certain types of body modification, like tattoos, to be very culturally deviant, where others consider them to be highly normative. Lying is something we consider deviant in some situations, but not others. And while we tell ourselves that lying is always wrong, we can think of situations where we're generally expected to lie, such as if somebody asks us if we like their haircut. It may even be considered deviant to tell the truth in such a situation. You may even ask yourself whether remarks about someone's haircut or weight even count as lies, since we're socially expected to lie. These images represent types of body modification that are generally considered deviant in U.S. culture. We have examples of extreme piercing, examples of someone so heavily tattooed that they're almost unrecognizable, and examples of extreme cosmetic surgery. In this slide, we have examples of types of body modification that are generally considered very normative in U.S. culture. The majority of U.S. women have pierced ears, as well as a sizable minority of U.S. men. A majority of young people now have tattoos, and we consider subtle cosmetic surgery to be pretty normative as well. As with everything for functionalists, deviance is considered functional. That is, it reinforces social norms. The function of deviance, that is specifically to reinforce and strengthen our social norms. What this means is that by recognizing and punishing deviance, we actually reinforce what's important to us. Every time we punish someone for stealing, we socially rehearse the idea that it's wrong to steal. Every time we punish someone for parking in an inappropriate parking spot, we reinforce the fact that there are appropriate and inappropriate ways to park. For functionalists, recognizing and punishing deviance collectively also promotes social cohesion. So when we watch media coverage of a criminal trial, what we're doing is reinforcing our collective shared norms as a society. For these reasons, a functionalist would say that deviance actually strengthens society. The structural strain theory of deviance describes several patterns of deviant behavior. It focuses on society's goals, that is, things that society considers it appropriate to have or to achieve, and society's means, that is, the ways in which we go about achieving goals. And it describes 5 types of people who react differently to society's goals and means. So, for example, conformists are those who accept the goals of society and the means. Innovators accept the goals of society but reject the means. Ritualists accept the means but reject the goals. Retreatists reject the goals and reject the means. And rebels come up with entirely new goals and entirely new means for achieving those goals. So let's use the example of running for fitness. I used to be a runner, and I was what you would call a ritualist. So some runners are conformists. They accept the goals that you want to run farther to get fit and be healthier. And they accept the means of getting there, to train and practice running. Uh, Innovators accept the goals, but reject the means. An example of this might be someone like Tim Ferriss, who accepts that the goal of running is to become healthier and more fit, but he rejects the means of slowly and consistently training and practicing, um, preferring instead to find hacks for getting to those goals in a faster and more interesting way. I was what you'd call a ritualist. I didn't really care about running faster or becoming more fit or becoming healthier, but I practiced anyway. I carefully trained. I went to fitness classes. I joined a gym, and I ran miles every day. Did I ultimately achieve the goals? I did, but they weren't important to me. But since I practiced the accepted means, I got there. A retreatist would be someone who said, you know what? I'm not going to run. I'm not going to train or practice running because running and fitness and health are not that important to me. And a rebel might say something like, fitness isn't important to me, and what's important to me is body acceptance. I think what's important is to recenter and prioritize people with unathletic bodies or with a diversity of body types. And the means for getting there is to publicize and destigmatize different levels of strength, fitness, and ability. The differential association theory of deviance is a very popular one in our kind of collective discourse as Americans. It's also known as the subcultural theory of deviance. This is what your parents are talking about every time they accuse you of running with the wrong crowd or being friends with people who are a bad influence. The idea is that we learn deviance by association with deviant groups, and that we internalize the norms of the deviant group rather than normative groups. So, for example, if you were to become an animal rights activist, you would likely join an animal rights activist community and learn to do deviant things, that is, non normative things. Remember that deviance could be positive or negative. Learn non normative things by association with other people already in that group. The labeling theory describes a process through which individuals may internalize deviant behavior or deviant identities. It focuses on how we become consistently deviant persons, as opposed to just persons who occasionally do something deviant. So, for example, a person who commits a primary deviance is just any person who violates a social norm. The labeling theory says that when this primary deviance takes place, the subject is caught and labeled as a deviant. Secondary deviance is when the subject then internalizes the deviant label and continues to deviate, thus living up to the label. And tertiary deviance is the stage in which the individual redefines the label as a positive thing. An example might be cheating on a test. Most students cheat on a test at some point in their lives. Not you, of course. You're an honest student. But most students do. The primary deviance would not necessarily be the first time you cheated on a test. It would be the first time you got caught cheating on a test and punished for cheating on a test, thus labeling you as a cheater. So if you think about what happens when you commit academic dishonesty at BSc and you're caught, you go through an honor council hearing and you get a mark on your transcript. This could be considered a labeling process. Secondary deviance would be a process through which you then, the cheater, internalize this label and think to yourself, gosh, I've been labeled a cheater. I'm a person who cheats. I am a cheater. That's who I am. Thus, you think to yourself, well, I'm a cheater. That means I cheat. So you continue cheating, thus living up to the label that you are a cheater. Tertiary deviance is the final step in this process through which you, the new cheater, the newly labeled cheater, would say to yourself, you know what? I'm the smart one here. I'm doing the right thing. If you're not cheating, you're not trying. Why wouldn't you cheat? The system is rigged anyway. Cheating is the only way to go. Stigma actually relates back to the dramaturgy theory that we talked about in Lecture 4. If you remember our friend Erving Goffman and his discussion of presentation of self, personal front, and face work, stigma relates directly to that theory. So a stigma is a spoiled identity. It's basically having a characteristic that defines one's entire identity as deviant. The example that Erving Goffman gives in his work entitled Stigma is that of a recently released psychiatric patient. That is, a person who's been diagnosed with and treated for a mental illness and is now released from a mental hospital. Our society defines persons with mental illness as being deviant. That is, we consider their whole identity to be non-normative. Those persons experience spoiled identity. Goffman says that stigmatized persons almost always try to engage in passing where this is possible. For example, a person with mental illness generally tries to present themselves as a person without a mental illness. They may do this by denying that they have a mental illness, by attempting to cover up or hide their symptoms, or they may simply choose never to tell anyone that they have a mental illness when it's possible to avoid doing so. However, stigmatized persons may also practice selective disclosure. For example, it may be necessary for a trusted friend or coworker to know that you have a mental illness so that that person can help you to pass in most other situations. It may also be necessary to selectively disclose to other persons who you know have mental illness to get support and share strategies for managing your spoiled identity. Further, stigmatized people may go on to form an in-group identity related to their stigma. So, for example, people with mental illness may choose to form support groups or form advocacy groups advocating openly for better inclusion and better conditions for persons with mental illnesses. Stigmatized persons may also engage in active reframing of their stigmatized identity. For example, many people have written books about conditions like bipolar disorder and schizophrenia and their relationships to creativity and art. So an example of formation of in-group identity and active reframing is the debate between two activist perspectives or activist groups, one being Autism Speaks and the other being the Neurodiversity Movement. Autism Speaks is an organization which advocates for research on autism and specifically research geared toward finding treatments and cures for autism. So this is an example of formation of in-group identity, but specifically it's created by parents and loved ones of people with autism rather than autistic persons themselves. The neurodiversity movement is formed by people who actually have autism and other what they call neurodivergent identities. That is, atypical neurologies. And that's how they reframe having autism or a similar condition, is as just another expression of human neurology. That persons with autism aren't sick and don't need a cure or treatment. Rather, they're just another manifestation of diverse human neurology. And that their neurology manifestation presents both strengths and weaknesses. So rather than cures, what they seek is understanding and acceptance and patience for people with autism, as well as kind of greater inclusivity and greater structural changes that would make their lives easier and better. Please watch this documentary and then consider the discussion questions in the following slide. The documentary takes about 45 minutes to watch, and it has subtitles because even though the people in the documentary are speaking English, they are speaking with very strong Scottish accents most of the time, so it may be difficult for people who speak English to understand clearly. After you watch the video, please consider the discussion questions and consider talking about them in the discussion forums on Moodle.